Some of the disruptive technologies and approaches that we are experiencing in the industry, and we'll wrap up shortly. So the first is an increasing access to data. What we're seeing is an individual right of consumer access to their own data, and CMS has launched an initiative for Medicare patients to have access to their data through the Blue Button initiative. And what this is going to enable is more easily have patients' data transferred to themselves so they could use it in their own medical care, and they can transfer it between physician and care. We're also seeing an increased effort for price transparency. By having access to data, consumers can make better decisions. And what we see here is President Trump and Seema Verma from HHS working together to drive increase in price transparency. And there's certainly a lot of initiatives on the federal level to make prices more transparent and available to consumers so they can become better shoppers. And we're seeing that, with interoperability and real-time benefit check. We're seeing CMS consider requiring health plans to make prescription drug prices available in electronic prescribing systems for providers so that they could select the lowest price drug. And then finally, we're seeing big data get into the game. Cloud servers like Google and Amazon, AWS, Microsoft, etc., are working with health systems, and the one that was in the news recently was Ascension and Google working together. And the moral of the story here, the thing to pay attention to here, is that the data needs to be used appropriately. So one of the things you'll want to be paying attention to is, where's your data going, and is it going to be guarded appropriately, and is it going to be used for appropriate purposes? We are also seeing a minefield of information for consumers. And so this is a growing concern as well, potentially, and a potential disruptor. Social media and other technologies are making information more readily available to consumers. The question is, how high quality is that data for consumers? It's blurring the lines between what people are seeing between experts and information that's shared between peers. There's certainly an increase and continued spending by pharma to promote their medication products. And we're seeing some potential concerns around drug deliveries from out of the country in response to high drug prices. So something to watch out for are medications being shipped in that perhaps are not of the highest quality for consumers, as consumers are pivoting to in order to manage high drug prices that they're experiencing. Finally, the last point I'll make before I wrap up our disruptions is we're starting to see pharmacists take a more active role in delivering care. And I've listed a few examples here where pharmacists are becoming more and more active managing prescription drugs for consumers. So in Oregon, for example, pharmacists are now able to prescribe birth control. Pharmacists in Oregon are expanding their capability over what medications they can manage. In Idaho, for example, pharmacists and pharmacy technicians are prescribing naloxone, and in California, pharmacists are prescribing HIV medication. So this is enabling and starting to change how we're thinking about where medications get started, and then once they are started, who's managing the medication. So we're going to want to start to think about how we can incorporate pharmacists to help manage and lower costs for consumers overall. So in summary, what can we do to really learn from our previous lessons, and again, watch where the market's going, and see if we can pick the best prescription benefit for employees. So one, our recommendation, pick a benefit that encourages medications of good clinical value, cost and quality, and see if we can generate savings without relying too heavily on rebates, because they can be potentially problematic. Also, look for a benefit plan that does support healthy competition. Competition can improve quality and lower costs, so encourage your employees to be better healthcare shoppers whenever possible. When it comes to data, support health plans that encourage data transparency and data interoperability. That can enable solutions that help consumers make better decisions and can lower the cost of care. Watch for more changes here in the future. There's going to be a lot more coming. This is just a brief introduction. And then finally, stay involved. Support those services that encourage your employees to stay active in managing their health. There are innovative services on the way that can be potentially disruptive.